Hey, I'm Dr. Brian McKay of Core Health in Darien. I want to talk to you about the back pain project, give you a little rundown how it came about. But more importantly, I want to focus today in on the Groston technique or IASTM. IASTM, which stands for Instrument Assisted Soft Tissue Manipulation. All right, a little rundown on the back pain project. Back pain is very complex, and at times it's very easy to fix too. So it has both elements depending on how long you had the problem. Typically, people are going to seek out like the fast pain relief, and that's okay. Believe me, I understand it. Um, Through using different pharmacological intervention. Well, that works. It will get you out of pain, but the back pain project is more focused on eliminating the underlying causes of pain. And so today I mentioned Groston or IASTM. And what we're dealing with there is it's called something called an adhesion. Now, an adhesion is a type of scar tissue, and it kind of binds areas of tissue that are not normally joined together. So, say you damage the erector spinae or quadratus lumborum muscle in the lower back, and the tension on the muscle doesn't really get fixed. The pain goes away because you're blocking the pain by taking a medication, maybe getting a cortisone injection, but you're not fixing the underlying stressor. So there's a physical stress. So other parts have to work harder. Muscles get stretched, ligaments get stretched, and you have scar tissue, which is not a good thing to have. I mean, you have scar tissue, you have surgery, but scar tissue that forms is not necessarily healthy tissue. It's disorganized, whereas typical, muscle tissue is very highly organized. So what we have here is we have the adhesion. The adhesion is like just imagine a bunch of X's and O's thrown down, to create it buttresses an area. So let's say you have again. Let's use the rectus spinae. The rectus spinae on the right side is weak. What we have to do is we have to like tighten that up so that it can do the job, but it's not going to do the job as good as it could if you didn't have the adhesions. So Groston was actually an osteopath. An osteopath is kind of a cross between a chiropractor, a medical doctor. They're more popular in Europe. There are schools here in this country, and Groston was an osteopath. And what he did is he kind of took his technique from Oriental medicine and basically coining, cupping, a whole bunch of different terms to describe it. What you do is you lubricate the surface of the skin, and you go in and you just use a tool. For those Groston or ISTM, it's pretty much going to be a stainless steel tool or a very dense plastic these days, just as well. And what you do is you erase the adhesions. Just think of it like an eraser, giant eraser going in, taking the tension out of the spine and all of those, and where these muscles, these fibrous bands of muscle-like tissue form. And you'd be surprised because one thing is the adhesion doesn't have the same length, so you're gonna allow for more mobility. I'll be honest with you, working a Groston tool or an IASTM tool can be painful, but almost instantaneously you can feel better. You can feel more mobility and much more and a significant decrease in pain. So the adhesions form in the fascial plane. Fascia is the covering on the muscle. So when the fascia is, you know what? Let me take a step back. Let me explain fascia a little bit better. So you have the covering on the muscle. The muscle, I want you to think about it as say you took a Ziploc bag and you put some hamburger meat inside. The hamburger meat inside is the muscle. The Ziploc bag is the fascia. And it's typically where you develop adhesion is going to be in the fascial plane. Uh, Unless you a deep, deep bruise, and you may have it in the muscle as well. But so typically the fascia, you have to understand is very nerve rich. So you can have a lot of pain there. And so what happens is it kind of like shrinks and shrivels up the muscle a little bit when these adhesions take up valuable real estate on the surface area of the muscle. So the technique basically, which got started in Oriental medicine and now Groston to IASTM, releases these adhesions and allows for faster healing, especially in chronic cases. You got a chronic low back pain. you're going to have adhesions. The body's going to try to buttress up the area since you can't do it physically yourself. You biomechanically altered structure. When you biomechanically alter a structure, it's of utmost importance to get the structure working properly to remove that tension. But you're still going to have the adhesions. Unless you break up the adhesions with Groston or IASTM, you're going to have that remain. So what we have here is we have a really valuable tool, which is a part of what we do here at the Back Pain Project, but it's only a partial tool. There's many, many tools. And if you have chronic low back pain, this could be your answer to ending your low back pain. Not just Groston for these adhesions that form in the back. No, there's a lot more to it, and that's topic for another day. But Groston is a soft tissue treatment that addresses adhesions. And adhesions are a band of scar tissue, and it can be quite painful. Some adhesions are less painless, but over a period of time, they're going to become more painful and restrict your mobility. Restricted mobility is going to add to arthritis and just more chronicity to your back pain problems. So if you have a back pain and you'd like some help with it, Back Pain Project located in Darien, we're here. Come give us a chance. You might be pleasantly surprised at what we have to offer you and back pain. All right, Dr. Brian McKay, Back Pain Project, Darien, Connecticut. Love to hear from you. Thank you.